Hello, welcome to Open Enrollment 2020. I am Robin Jones with the Human Resources Department for the Diocese. Joining me today is Bill, our Employee Benefit Consultant.
Hi, I'm Bill Rasmussen with Alliant Employee Benefits. I'm the Employee Benefit Consultant that helps the Diocese with their benefit programs. I'm here today to talk about the 2020 open enrollment changes to the medical and pharmacy plans. We're going to be talking about new lay staff wellness programs called the Healthy Merits Program, which we think is going to be very exciting for you to help you with your health. And we're also at the end going to talk about how to enroll and make changes so that you get all of your enrollment done before the deadlines for open enrollment. So there are things that are staying the same for 2020. First of all, the medical plan provider will stay the same. Meritain Health will continue to be our administrator, and they will be using the Aetna POS Choice 2 network, as we have been in the past. The pharmacy program will have changes, and we'll talk more about that in a few minutes. Also, the dental plan that's been in place with Delta Dental, the PPO plan, will stay exactly the same, and costs are not changing for the dental plan. The vision plan, which is through VSP, will have no change in rates and no change in benefits. And as always, with both the dental and vision plan, you'll get the best value in those programs if you see in-network providers. And then last but not least, the life and disability programs will remain with Hartford, and for the voluntary portions of that program, there will be no changes in rates. Okay, so what's new? We do have several changes going on in the medical plan. Denise McWilliams from Meritain will talk about some of those in more detail in a few minutes, but the standard plan will have office visit and urgent care copay changes, and also the out-of-pocket maximums will be increasing in that program. The high deductible plan will also have a change in the out-of-pocket maximum that will also be increasing for 2020. And then we will also be seeing contribution increases to the payroll deductions for both the standard and high deductible health plans. We've had significantly greater utilization in our plans the last 2 years, and so that, along with the fact that we're seeing larger claims, has contributed to the fact that that the diocese costs are going up dramatically, and unfortunately this year we do have to pass on some of those increases. The diocese is still making a significant investment in the medical plan. Our contributions as a percentage of the total cost are much greater than 70%, so the investment is still there. We are also seeing significant increases in pharmacy costs, especially related to specialty drugs, which is also contributing to why our costs are going up so much. As you review the changes, you may want to make changes in the medical coverage that you have. You will need to actively enroll in either the standard or the high deductible health plan during this open enrollment if you do continue your medical coverage. So what else is new? The management of our pharmacy plan is changing from Meritain Health to a company called MedImpact. MedImpact will also be supplemented by a Catholic healthcare system called Bon Secours Mercy Health, and they will be providing our mail order and specialty drugs going forward. And they will also be providing a white glove concierge service that will be provided by their pharmacy experts. We believe that this program will provide significantly greater value for you, particularly as it relates to your out-of-pocket costs and also savings to the diocese. All of your pharmacy benefits will remain the same, so there will be no changes to the pharmacy benefits. At this time, I would like to introduce Denise McWilliams with Meritain Health, and she's going to talk about the health plan changes that will be occurring for 2020.
Hi everyone, my name is Denise McWilliams and I'm with Meritain Health. As Bill said, I'm here today to talk to you about the plan changes for 2020 to your medical plans. You continue to have two plans to choose from, the standard plan and the high deductible plan. The calendar year deductibles remain the same for both plans, but there is an out-of-pocket maximum increase for both plans. So for the standard plan, your out-of-pocket per individual is going to be $3,500, and that will be capped at $7,000 per family. For the high deductible health plan, the HSA eligible plan, the employee single out-of-pocket will be the same $3,500, and for family coverage, that out-of-pocket maximum will be $7,000. So next I'd like to talk to you about office visits. Wellness preventive care visits continue to be paid at 100%. We encourage you to take advantage of that and have your preventive care every year. For primary care office visits, instead of a flat dollar copay, you will now pay 20% of the cost of the service. For the standard plan, as you do today with the high deductible health plan, but the deductible is waived for the standard plan. So for the standard plan, again, instead of a flat dollar copay, you'll pay 20% of the cost, but no deductible. For the high deductible health plan, you'll continue to pay your deductible first and then 20% of those services. For a specialist office visit, you will pay, again, the 20% coinsurance instead of a flat dollar copay. The deductible is waived on the standard plan. On the high deductible health plan, that continues to have always the deductible apply first, with the exception of preventive care, and 20% after that. So the next change, all other services remain the same at 20% after deductible. But I want to talk to you a bit about urgent care and emergency room services. So again, today there is a flat dollar copay for urgent care, and there is a flat dollar copay with coinsurance following that for emergency room services. Your urgent care will go to a 20% copay with no deductible, just 20% copay or coinsurance. Your emergency room copay will move to $300 per visit, and then the 20% coinsurance will apply. The important thing to remember with a 20% coinsurance instead of that flat dollar copay that we all get so comfortable with is there will be times when you will actually pay less with a 20% coinsurance than you have paid in the past with a flat dollar copay. For example, in an urgent care situation, you used to pay I think a $45 copay, but you have the option to go to, instead of urgent care, you will have the option to go to, for example, the CVS Minute Clinics for many of the same services that you would have gone to urgent care for, but at a lower cost of care. So 20% of a Minute Clinic charge will be much less than 20% of an urgent care visit, and certainly much less than an ER visit. So we want you to go to the ER when you truly have an emergent situation. Don't ever hesitate. But if you can get your care after hours at a Minute Clinic, even instead of an urgent care, you will save money and you will help the diocese save money. So I would like to talk to you a bit about Healthcare Blue Book. You have access to Healthcare Blue Book today through your Meritain portal. If you haven't registered, go to meritain.com and absolutely click on the button at the top right corner and register for that portal. That's where all your information is. That's where your claims information is. You can order ID cards. There are many pieces of information that you have access to through that portal that is secured to you and you only. All you have to do is set up a username and a password. Now, when you go into that portal, there's going to be a button in the center of the screen that will say Healthcare Blue Book. This is a tool that you have access to find out in advance what the cost of services might be. For example, if you need to have an MRI, that MRI is significantly lower cost at a standalone freestanding facility than it would be at a hospital. So we encourage you to use the tool. It's your way of being a good consumer. You shop for many things by comparing prices in your everyday life. This is a way to compare prices for your medical services. With that, I would like to turn it back over to Bill to talk a little bit more about all the other benefits that you have in 2020.
Thank you, Denise. I appreciate your going through the medical changes with us. I'm now going to go over the pharmacy program changes that are being made for 2020. We're very pleased to announce a new partnership with Bon Secours Mercy Health for mail order and specialty, and MedImpact as our new pharmacy benefit manager. MedImpact will replace CVS as our current pharmacy benefit manager. So you will still be able to access CVS pharmacies. CVS pharmacies are part of the MedImpact retail network, but CVS also does the pharmacy benefit management of our program today, and they will no longer be doing that going forward. Bon Secours Mercy Health is a nationally recognized health system with locations in Florida, and they will be offering us a white glove concierge service for all issues related to the pharmacy program. If you have questions about drugs that are being prescribed by your physician, they will also reach out to you at times when a drug might not be on the formulary with recommendations on what changes that you'll want to make. And they will also be involved with working with your physicians when they prescribe drugs that might not be on the formulary. We're very pleased to announce this partnership because we believe it will bring significant value and savings to not only the diocese, but also to you, the employees, and your families. The pharmacy benefit information will be on your Meritain card, so you'll get a new Meritain card with the new pharmacy benefit manager information on that card. There will be no reason for you to carry two cards. One of the programs that's going to be new for you this year is to help control costs for the diocese and also for you. The Bon Secours Mercy Health centralized home pharmacy delivery will be required for any ongoing maintenance medications. For prescriptions like for blood pressure medicines, cholesterol, diabetes, things that are taken by you on a regular basis, ongoing basis, these prescriptions will be a 90-day fill required through Bon Secours Mercy Health mail order. The copay for maintenance drugs will be 2 times the 30-day supply, which is an improvement over today, so you'll save some money on a 90-day supply of maintenance drugs. You can also use your local pharmacy for the first 2 30-day prescriptions, and then at that point you will need to be set up on the maintenance drug program through mail order. So any acute short-term medications, such as medications for infections, the flu, things like that, those will be filled at your local pharmacy, and the network that's offered by MedImpact is very similar to the one that you have today. So the same pharmacies that you're going to today will be in the MedImpact network. There may be a few exceptions to that. If there are situations like that, Bon Secours Mercy Health and MedImpact can help you find a pharmacy close to you, but all the major retail pharmacies will be in there. The Walgreens, the CVS, Walmart, all of the others will be in their network. Specialty medications will also be filled by the Bon Secours Mercy Health concierge team. They will be reaching out to you if you're currently taking a specialty medication to help you make the change. They will go through specific guidance for you as to how the specialty medications will be delivered going forward, and they will also be going through the program changes that are being made that will help you with your out-of-pocket costs. There's some really exciting changes being made there that will save you some money. We do encourage you to consider using, as you have in the past, GoodRx. It's a discount program that you can download an app for. It's not tied to any medical or pharmacy plans, but there can be up to 80% discounts. This is particularly helpful for the high deductible health plan when you know that you're not going to be meeting your deductible. If you are going to be meeting your deductible, then it's probably not in your best interest to use GoodRx because you're going to want the pharmacy expenses to accumulate towards your deductible. That will save you money in the long run. But if you're not going to meet your deductible on the high deductible health plan, then you should take a look at GoodRx. You can visit their website, or you can download their app, which is very easy to do. It's a free app. It will also allow you to compare prices. Even if you're not going to use their discounts, you can compare prices with the various pharmacies across the region. It will really help save you some money. As I mentioned in the early part of the presentation, your monthly cost will be increasing. The grid shown here shows you for the cost increases for payroll deductions for the standard plan and also for the high deductible health plan. We realize it's unfortunate that we have to increase payroll contributions. However, we have seen sharp spikes in our medical costs over the last couple of years, and we are a self-funded health plan. So those costs basically revert to our bottom line. It's not like we're buying insurance from an insurance company. We are a self-funded plan. So with our costs going up, we have to pass some of that on to you. And we realize that this is a challenge for many of you, but going forward, we're going to do the best that we can to implement programs that will help get our costs back in line. And hopefully at some point, these costs will not go up any further. The dental and vision plan costs are remaining exactly the same, so they are not changing for 2020. So we're pleased to report that. I'm going to go through a few other programs right now that I think will help you control some of the costs that you have related to the medical plan. The telemedicine program, or the virtual medicine program called 98.6, has been in place for a year. Hopefully all of you have downloaded the app for 98.6 and registered with them. It will allow you to get care anywhere through a very easy texting process with primary care physicians that can help you with many medical issues. It's not going to be something you would use for something of an emergency situation, but it will help you with minor ailments, illnesses, things like sinus infections and common colds, ear infections, things like that. You'll be able to get treated using your smartphone and registering with 98.6. The cost for this program is spectacular as it relates to the standard plan. There is no cost for this program whatsoever. For the HSA plan, the high deductible health plan, it's only $5 for each visit. So you do have to be enrolled in the diocese medical plan in order to access this care, and we hope that you will take advantage of it. So I've put a chart up that you'll be able to see in this presentation that kind of outlines a grid of where should I go for different circumstances, kind of from a lowest cost perspective to a highest cost perspective. 98.6 being the lowest cost that you could do. The second lowest cost category would be going to a retail clinic like the Minute Clinics that Denise described earlier. And those programs will save you significant money if you go to those retail clinics. Urgent care would fall after primary care physicians. Primary care physician is where you're going to want to go for much of your care. And then urgent care would be the place you would need to go if you have an urgent situation after hours that you need to have treatment taken care of, or have your diagnosis taken care of. And then of course the most expensive place you would go would be the hospital and standalone emergency rooms. They are going to be the most expensive, but if you have an emergent situation, life-threatening situation, that's where you're going to want to go. So for those that are confused about the best plan for you, just a couple of highlights on the high deductible health plan. This is the plan where you're going to pay the least amount in terms of your monthly premiums. This plan allows you to save for future health care expenses through a health savings account, and also the diocese contributes to your HSA. So this is going to be where you're going to potentially save the most money in terms of, again, your monthly premiums. The standard plan has a coinsurance for physician visits and urgent care without meeting the deductible, and you're going to pay as little as possible for each time you visit a provider. So if you want a more predictable outcome in terms of your office visits and your prescription drugs, the standard plan would probably be the one that you would choose, but the cost for that plan will be higher than the high deductible health plan. The health savings account, which applies to the high deductible health plan only, allows you to participate if you're in the high deductible health plan, you can participate in a health savings account. The diocese will contribute $50 per month for single coverage, $100 per month for family coverage. You can also contribute up to the IRS maximum of $3,550 for single coverage and $7,100 for family per year. If you're over age 55, you can also contribute an additional $1,000. The great thing about this is that you can make these contributions during the year. If you need to pull back on the contributions or if you want to increase your contributions up to the IRS maximums, you can do so at any time of the year. So if your budget changes, you can make changes accordingly. You must set up an HSA account through Benefit Wallet to be eligible for diocese contributions. So if you're making a decision to move to the high deductible health plan, please work with your human resource folks, Robin and her team, to get Benefit Wallet set up. You will have to do that in order to be eligible for the diocese contributions. Again, the benefits of an HSA, it is payroll deducted. You can change the election at any time. The money goes in tax-free, it grows tax-free, and it's distributed tax-free as long as you're using it for medical expenses. You also will get a free debit card that will be good, that you can use at the doctor's office, that you can use to apply for your coinsurances before the deductible's been met, and for any other out-of-pocket costs as well. Your HSA account will stay with you even if you switch plans or leave the diocese. You'll always have that money available. If you do switch to the standard plan, however, you will not be able to make payroll contributions into the HSA on a tax-free basis going forward. The balance does roll over from year to year, and if you ever leave the diocese, that account goes with you. And after retirement, you can still use the HSA to pay for Medicare premiums or to pay for prescription drug co-pays or other things associated with your healthcare expenses after you retire. The next programs that I'll talk about are the life and disability programs. Hartford will continue to be our insurance carrier for these programs, and as I mentioned earlier, for the voluntary components of these programs, the rates are not changing for 2020. So the basic life and AD&D insurance, $25,000 is available to you while you're employed with the diocese. Both you and the diocese share in the cost of the program. If you want this program, it's $3.18 per month for coverage regardless of your age. And it's a very inexpensive program for you to be able to cover for your funeral and other final expenses. The long-term disability is not changing. The benefits are not changing. There's no cost to you for this program, and it will pay 60% of your income in the event you're unable to work for 90 days. It is payable up to 5 years. The short-term disability is a voluntary program. Premiums are payroll deducted each pay period, and this is effective while you are employed with the diocese. If you leave the diocese, this program is no longer available to you. The benefit is 60% of your income in the event you're unable to work after 14 days, and it's payable for 11 weeks. It's payable for up to 4 weeks if you come into the program with a pre-existing condition, which essentially occurs during the first year. The age-banded rates are shown on this exhibit, and it's a very good program for those of you that feel like you need protection for a short-term disability or significant illness. You can enroll in this during open enrollment. The voluntary life insurance also continues to be available. If you want to get additional life insurance, it's available for your family should you pass away prematurely. Very affordable, very inexpensive group premiums. It's going to be about the cheapest way you can buy term life insurance. It is payroll deducted. The rates are age banded, meaning that every 5 years they will increase on either a 5 or a 0 birthday. The rates would go up April 1st after you age up. Accidental death and dismemberment is included, and it is portable. This coverage is portable if you leave the diocese employment. It is guaranteed coverage without health questions up to the guarantee issue amount. And you can buy up to $500,000, but not greater than 5 times your annual salary. Employees must enroll in voluntary life in order for your spouse or children to be able to get that coverage. The guarantee issue is for new hires only. You will need to, the guarantee issue is $180,000 for new hire employees. So if you're newly hired recently, you would be able to get up to $180,000. If you're $50,000 for spouses and $10,000 for children. If you want coverage after you've been with the diocese for a while, you will need to provide evidence of insurability for any amounts over the guarantee issue. Evidence of insurability is not available or not required for children's coverage. You can choose to decline coverage and enroll in the future, but then you'll need to provide evidence of insurability. At open enrollment every year, you can enroll for $10,000 or $20,000 additional coverage if you're already in the program. Some additional value-added services that the diocese continues to provide. We do hope that you will take advantage, if you haven't already, of the Employee Assistance Program. It's at no cost to all full-time eligible employees. Free counseling, confidential counseling, and up to 3 face-to-face counseling sessions per member per incident. There's a lot of different services available in that program: financial counseling, social work counseling, parental or grandparent senior living help, things like that are all available in that program. Also, you do have a travel assistance program that's at no cost to you. It includes identity theft protection and emergency travel assistance. And then last but not least, available at no cost to you if you're enrolled in the voluntary life only, is beneficiary assistance. If you would pass away, you're in the voluntary life, your beneficiary will be able to get assistance in what to do with the money, where to go with it, other services that might be helpful, estate guidance, funeral planning, and concierge services.
Thank you, Bill. Before we discuss the details of the enrollment period, I'd like to introduce you to Patricia Tucker with Meritain Health. Patricia is going to go into details on our new wellness plan, Healthy Merits.
Hi, my name is Patricia Tucker. I'm a wellness consultant for Meritain Health, and I get to talk to you about your wellness program. So you've heard information on your health care benefits, and one of the ways that you can actually help tame those costs is to stay healthy. And I don't want people to start thinking, oh my gosh, I have to go on a diet, start exercising, because being healthy is about more than that. We've got emotional health, we have financial health, we have societal health. So there's all different types of health, and we try to focus on the whole person. So you get to earn rewards. I'm going to just talk to you just for a couple minutes about those. So there's a couple of things you can do. There's what we call an age gauge, and the age gauge is actually your health assessment. And it's actually really fun to do because it asks you questions about your health, what you do every single day, foods that you eat, what maybe if you have your blood results from your BMI, your blood pressure, you drop everything in there. And not only does it give you your actual age, but it tells you what your health age is. So sometimes you're really excited about it, and then maybe sometimes you're not so excited about it. But if you complete that age gauge by June 30th, you'll be entered into a raffle to win a $25 gift card. The next thing is that you have to earn points throughout the year. And It's really simple. There's 4 challenges, and once you do that, there's going to be additional gift card drawings throughout the year, and those will be announced to you as they come up. The most important thing for you to do is to make sure that you register for the web portal, and all of that information is going to be on your benefits site. And then secondly, you have to complete the age gauge, the health assessment. It's called age gauge, and I'll show you that in the next few slides. But to earn any other points, you absolutely have to do the age gauge. So here's some point opportunities. Really simple, like I said. We have all these cute little names. Say ah is go in and have a wellness exam. So if you're already doing that, that's 25 points you earn just for going to the doctor. Probably something that you're used to doing. We have what's called Healthy You, which is just go online and complete 8 courses from our university. No buts are for those of you that maybe struggle with tobacco use. So whether it's, actual smoking cigarettes or vaping or doing the snuff, there's a no buts program for you. And then the Move It, which is really fun. I'm going to show you that little, what that's going to look like. But if you're already being active, you know what? You may as well earn some points for it. And maybe it's just as simple as walking. I'm going to show you that in 1 minute. And then a wellness event. So for those of you that actually go out and maybe do a half a marathon, a 5K, a 10K, we're going to give you points for that. If you get your flu shot or your dental exam, you're going to get points for that as well. And then there's also quarterly company challenges. And that's where I think you start having a little bit of fun. Those get announced to you throughout the year. So our wellness portal, as you can see here, the head here, we really want you to know who you are, what your purpose is, for emotional health, financial health, social, occupational, physical. We try to take that whole person approach when it comes to wellness. So you can see here that we have company challenges on that web portal. It's really fun. I know you're probably thinking, I don't want to do that, but there's personal challenges also. If you're maybe one of those shy people or you're just not into being competitive or things of that nature. There's all kinds of health topics that you can look up. There's multimedia tools that you can engage in. There's online health coaching. It's all digital, so you go in there at your own on your own time and go ahead and just learn about some things that maybe you've had some questions about. There's also an opportunity to build personal challenges, which is my favorite. Just especially like if you want to invite some friends along with you, we have challenges for that. You're able to go on to dopt.wellrite.com and just create an account. You're going to use your medical ID that's on your insurance card. And I just want to also say everything on that site is completely confidential. It's yours. And nobody on the employer side will ever see it. We do run aggregate reports just to keep your HR people updated to who's using the site. So just watch your emails and information for more details to come on how to enroll. So these next few slides are just pictures of the website. So this is the age gauge, and you can see here what that looks like. We have all these little tiles, and you can see that the age gauge is required, and it will give you a countdown. Like I took this shot a few days ago, and so this one says it starts in 7 days. But on 3/1, you are welcome to go in and begin your wellness activities. This next slide here talks to you about the wellness activities that we've set up for you. So the SAA, that's visit your doctor, and the Healthy You is where you're just going to go and learn some information about yourself. The No Buts program, the wellness event. So if you are doing the walk, run, whatever, super simple. You could take a picture of the completion and then just upload it to the site. And we're really easy. We just want to make sure that you're actually doing what we're giving you credit for. You can see that we've got stuff for Stop the Flu and also going to the dentist. And this is really easy to use. Once you click on one of these little tiles, it gives you all the instructions on what you need to do. And then here's your company challenges. This is the really fun part of it. So you can see that starting in April and May, there's going to be a couple of challenges that will be rolled out, the Eat Clean and the Upbeat. And then we've got some more for July and August, October, November, and then January and February. You can track all of your progress through a text message. We made it super easy. You don't have to be in front of a computer. You can use your phone, you can use your Apple Watch, your Samsung Watch, whatever it is you use, just to go ahead and track the company challenges. If you're not into doing the company challenges, you can also earn points for doing a personal challenge. The bottom there where I showed 3 squares, the reason I put that on there, on that right-hand corner it says make it peer-to-peer. So if you have a group of people here that you want to maybe really challenge each other, you can go in there, you can make it peer-to-peer, and you can invite the people that you work with and just really have some fun with it. Challenge each other, maybe do a little, encouragement, a little trash talk, whatever it is that you like to do. Here's where you're going to earn points for being physically active. So when you click on one of these little tiles here, you're going to see quarter 1. You can only click on the quarter that's actually active, but it's super simple to do. So you may have a wearable device. So if you have a Fitbit, if you have any type of a Withings, the Polar, whatever it is, the Garmin, you can sync your wearable device to this site, and those boxes will fill. And you'll see that you don't even have to track. Your little device is going to do the tracking for you, and it's going to pop up in your activity. If you don't have one of those, no problem. Don't even worry about it. You can, if you have a smartphone, you can have some apps. There's a couple of apps that are supported, and also we have a mobile app that will sync right to it. If you don't want to do any of that, like let's just say you can see all these little tiles on there, and I know it's a little bit hard to read. Maybe you're an ice skater. Well, maybe not down in Florida. Maybe you do Pilates. And you just want to go in there. This allows you to track it manually. And you can see here that where we're showing that once you do sign up with your mobile app, you can get text and email engagements. So it'll text you if you want. You can turn that off and on, but you will get emails. So every month when there's a new challenge, a new company challenge, you'll get a brand new email that says, hey, join us for Eat Clean or work out, whatever it is. And then I just really quickly wanted to show you that when you do track your physical device, there's a calendar on there. It's going to show up. And I don't know about you, but sometimes this is really motivating for me because I don't want to see an empty date on my calendar, right? I want to see it all filled in with how many minutes I've walked, how many calories, things that I've done. You can also use this, you can turn it on, a text reminder, you can fill this in manually, whatever you want to do with it, really simple. It's very versatile. And then you can see here that there's text reminders if you want it, text reminders for your own personal challenges, or if you want them for company challenges, whatever you want. You just make it your personal wellness program. This picture here is just our online education courses, and really it is just a smidgen of what we offer. You can look up things either by some type of a chronic disease, or maybe you just want information about anything at all. We have tons of information from financial wellness to heart health to pregnancy, whatever it is that you need information on, we have that here. And lastly, I'm not alone. I have an amazing team behind me. So once you've registered, if there's a question on anything at all, we have this Healthy Merits 800 number, 877 number, or you can email them to healthymerits@meritain.com.
Thank you, Patricia. And also I'd like to thank the other presenters, Bill and Denise. Now for the fun part, the open enrollment period. Our open enrollment this year will open on February the 27th and close on March the 5th. All full-time benefit eligible employees will be required to log in to Paycor. Once you log in, a task will appear and it will indicate that it's time for you to enroll in your benefits. You will update any changes to dependents or beneficiaries. You will make your benefit elections, submit your benefit elections, print a confirmation of your benefit elections, and provide to your bookkeeper or parish administrator for your personnel file. To enroll or make changes, go to www.paycor.com. If you should need any assistance with your Paycor login or password, please feel free to contact myself or Jeannie Blake. Your payroll deductions will not change in your Paycor paycheck until April the 1st. You can review the 2020-2021 Benefit Enrollment Guide online at paycor.com or the Diocese website. Please note, if you previously declined medical coverage or do not make elections effective April the 1st, you will automatically be enrolled in the high deductible health plan unless you can provide proof of other coverage elsewhere. You may continue to decline participation in the other benefits, dental, vision, and short-term disability, and life insurance. Okay, once again, open enrollment will be held February the 27th through March the 5th. Remember, all elections that you make will be final until March the 31st of 2021 after this enrollment period, unless you experience what's called a life event change, which is marriage, divorce, birth of a child, loss of a spouse's plan. All changes to your elections as a result of the qualifying event must be made within 30 days of the event date occurrence. You can contact Human Resources for more information. I'd like to thank you all for your time today. And if you should have any questions or need any assistance with your enrollment or medical plans, please feel free to contact the Human Resources Department.